Hello, welcome to today's presentation by ROI Healthcare Solutions and MedPower on COVID-19 and online learning tools to meet changing demand. Today's presenters are myself, Lori Mandozzi, Executive Director of HIS Services at ROI Healthcare Solutions, Jeff Tennant, VP of Revenue Cycle Services at ROI Healthcare Solutions, Brian Haggerty, CEO and co-founder of MedPower, and Matt Downing, Chief Marketing and Innovation Officer at MedPower. Off to you, Jeff, to start the presentation.
Thank you, Lori. So ROI and MedPower understand that ongoing training is essential, especially during these trying times. To accelerate the effectiveness of training for our clients, we've formed a partnership with MedPower. MedPower is a leading e-learning company that serves hundreds of hospitals across the U.S. MedPower's innovative microlearning system and training library are ideal for healthcare systems looking for a proven and effective online training solution. Today's topics: COVID-19 and the impact on the healthcare industry, COVID-19 and the impact on provider training, top alternatives to classroom training, introduction to MedPower solution and content library. We're going to have a MedPower demonstration showing the benefits of their tool. And then we'll have a recap and some contact information if you'd like to learn more about our offerings. Some of the impacts on the healthcare industry today, there's been a request for emergency funding to offset some of the impacts on healthcare organizations and the financial side of healthcare. We anticipate a significant loss in revenue due to canceled procedures, a significant increase in expenses for treatments related to COVID-19, increase in expense for staff that are having to put in overtime. We're literally bringing people out of retirement to help fill the need that we're seeing in healthcare today. The increase in cost of supplies, especially those that have limited supply and high demand right now. And then there are the billing concerns, as the ICD and CPT codes that are going to be effective as of 4/1. We have hundreds, if not thousands, of patients that are being seen, treated, and maybe discharging today. Keeping track of those patients and figuring out how to go back and retroactively bill for those services is going to be a key component as well. With the cases peaking in coming weeks, we assume we're going to hit a plateau here shortly. Providers are going to need to be trained on some of these new workflows as we transition them to more of a telehealth environment, right? In-person classroom training is no longer really an option, especially during this time. And so we need to provide opportunities to support providers as they adjust to things that are changing for them in real time. This is unprecedented in healthcare, as we typically spend a lot of time rolling out and preparing physicians for changes. These things are happening in real time and need to be addressed, and training needs to be addressed in the same way, real time and very convenient for providers who are already being overworked. Brian, if you could take us through some of the training and tools that MedPower provides.
Sure. Thanks, Jeff. I appreciate that introduction. So when we talk about the need for online training, it's sort of twofold right now. Number one, we have so many new workflows and new systems that have been utilized or need to be utilized due to the current environment. And number two, we need to use our resources appropriately. So by giving providers or clinicians access to education on their phones, on demand, not only when you have a surge of people who need to be trained on these new COVID-19 workflows or potentially new telehealth platforms that everyone is utilizing now, you need to have sort of an ongoing training strategy, because we know that everyone's not going to get things the first time around. So to be able to give them a very easy, user-friendly way to onboard themselves on how to utilize critical systems, and then give them a resource to use at the point of care going forward, has become increasingly important in this environment. And then secondly, thirdly, I should say, you really want to free up your clinical support teams. The folks that you normally utilize for training, at the elbow support, or who could normally help your clinicians, you want to utilize them in a way that is effective for your hospital at this point. And training and help desk or live help desk may not be it right now. What MedPower does is MedPower offers mobile training solutions, desktop as well, where we're going to give everyone access to education, again, mobily, but from a content strategy standpoint, it's all micro-learning based. So we're going to be able to help you onboard all your providers on these new workflows, as well as give them a micro-learning library going forward. And then what we do on the back end for your administrators is we measure the engagement and collect feedback. And we're going to talk about that a little bit more right after the demo, but it's very important that we measure our providers or clinicians actually utilizing the training that you're giving them. Are they engaging in it? And is that helping those performance indicators on the back end? Did it help them utilize their new telehealth platform? Were they able to understand the new COVID-19 workflows? And if not, we provide that feedback loop to be able to engage the clinicians who are not utilizing it correctly and make changes on the fly. So to address the need right now in this particular environment, MedPower has a very robust catalog of pre-produced courses on most EHR platforms. We have also partnered with our vendors to create specific COVID-19 training content. So to give you an example, we are offering free access to the new virtual visit platform for Meditech. And then we also have a library of pre-produced content in the acute, ambulatory sections for things like Cerner, Meditech, Allscripts, as well as point of care. And then what we've done to assist providers or assist getting your providers onboarded is we've been able to credential many of these courses. So a lot of your providers will receive actual CME credit for taking these courses. As mentioned in the previous slide, we're going to be offering these courses anywhere, anytime. So they can be sitting on their desktop, they can be sitting on their, or just have their smartphone on them, or a tablet, and be able to access the training via our cloud hosted system. And then we'll provide advanced reporting, feedback, and analytics to your organization on the training. So I'm going to go back to my screen right now, and I'm going to show you a quick demonstration of how our platform looks and feels and how it works. So if I log in to one of our client sites and I highlight the courses area and I list all the courses, this particular course is based around Meditech Expands. And as you can see, for this particular organization, what we've done is we've broken down the hospital into different specialties. And why that's important is because every specialty may have some sort of customized content that relates specifically to them. And more importantly, for the hospital itself, you're able to manage each specialty and each department independently. So based on what your needs are at that particular time, you can add content, we can manage the learners, we can add learners quickly. And I can see everything at a glance. I can see how many learners I've had in the course. I can see how many have completed the course. And for these particular courses, learners receive 2 Category 1 CME credits for completion. So if I go just down to a test course, and I'll click on a course. Once I click on a course, as you can see, it's very, very simple, easy, and user-friendly. And I think that's the most important takeaway for each clinician is that, especially in this environment, the training has to be simple and easy. So we give it to them in a very visual way. They have a dashboard of all the modules that are available to them. And if I click on a module, you can see I have a piece of micro-learning content. We tell them how long the module is so they know that, listen, this is only going to take me anywhere from 1 minute to 2 minutes to get through. And I click on that module and I'm able to get my content. And then I can easily navigate to all the different modules just by clicking on that. Now we're covering, as I mentioned before, we're covering two verticals here. So we're covering our onboarding process. So in an onboarding process, the learner would go through each module in its entirety and go to the bottom, and they take their last exam and they receive their certification. All admins are notified of who's completed the course. But once they complete that course, all the assessments are taken out and they're left with this great micro-learning library on how to utilize each particular system, which they can access on their phones on demand when needed. Now, as Jeff mentioned before, this environment is changing constantly. The workflows that are built out specifically for COVID-19 may change in a couple months from now. How do we go ahead and communicate to each learner what they need to know and when they need to know it when it comes out? So once we have learners engaged in a course, we have a news area, and that allows you to make announcements to your specific group of learners to let them know what new workflows have come out. And by just typing it in here and clicking send and notify, all the learners in that course receive a push notification that there is new content, new workflow available for whatever reason that might be. And when they receive that push notification, they're able to interact with that push notification and then go directly to content consumption. And I'll show you in a minute. What MedPower does is, again, we track all of that interaction. So we track how many learners you sent this out to, and then also who has consumed it and who has not. We have our assessments area, again, strictly for the CME process, so we can credential each provider. We have a resource area. The resource area will allow you to upload and add any resource that you want that you would normally email out to all your clinicians. So all the things that you would normally send out, whether they're job aids, some screenshots, manuals, etc., they can be positioned directly in the resource area for learners to access, again, on their phones. And then we have our learner dashboard. Our learner dashboard is, again, simplistic but robust. It's simplistic in the way that it's easy for you to visualize who all the learners in your course, what type of progress they're making in the course through a progress wheel. We can also see when they enrolled and visited the course. But more importantly, we track all their activity. So because we have a micro-learning approach to training, we track everything that every learner looks at, every day they log in, how many times and how long down to the second. And then by utilizing this data, we're able to provide a great dashboard insight to the organization over time to show you what people might be having issues with. And again, over a period of time, really connecting this data to those key performance indicators out of whatever platform it is you are utilizing. So if it's specific to a Cerner, we can say, well, let's connect this data with the data at Cerner Advanced and create a great overview of how the education is affecting those deficiencies that exist via the data in Cerner Advanced. And then this has become just an ongoing feedback loop based on where you are, what you're doing, what new education that needs to be put out. And education, as we all know, should just be an ongoing thing. It should just exist within every provider's day-to-day application. So I'm just gonna go back to the presentation. And now I'm going to turn it over to Matt Downing, again, who is the MedPower's Chief Marketing Innovation Officer, to talk a little bit about the MedPower turnkey solution.
Thanks, Brian. As Jeff mentioned earlier, we certainly understand that hospitals are under tremendous pressure right now to get providers prepared for this patient surge they're expecting, all with limited on-site resources. So to help, we've decided to offer our MedPower services in the pre-produced content that Brian walked through free for the next 30 days. In addition to that, we're going to be including the pre-produced courses on both the coronavirus or COVID-19 workflows that Brian mentioned, if you don't mind advancing, along with the pre-produced content that we've got for some of the key EHR courses. Because we understand as you bring on these new providers, many of them are either unfamiliar or, as Brian mentioned, need to get refamiliarized with how some of the workflows flow through the acute or ambulatory system. So we provide that just-in-time access or at-the-elbow support through our online mobile learning management solution, which, as we noted, is accessible both through our mobile app as well as apps for iOS and Android that can be accessed on or off the hospital network. So we allow you to reach beyond the hospital boundaries if you've got any remote staff that need to be trained before coming on site or supporting some of the new facilities that you're getting up and running. Next slide. So to get you up and running quickly, we've put together a number of materials and online training and support for admins and end users alike. We're providing online marketing materials that you can use to engage your providers. As Brian mentioned, we're also including the opportunity to get CME credits for certain courses as an added incentive. And most importantly, we're providing the analytics and reporting you're going to need to track your progress. And we found it's especially important during times in crisis like these to enable your providers to give you feedback on how they're progressing through the coursework and or to give you direct feedback on outstanding needs and things that they need to accomplish the tasks and to overcome the obstacles that they're facing every day in this changing environment. And should you need it, MedPower's also got a team of instructional designers that you can turn to in developing any urgent training materials that are outside your internal capabilities. And with that, I'll turn it over to Jeff to wrap things up for us.
Thank you, Matt. So as we look at the presentation today, some of the key takeaways, obviously, this is putting unprecedented demands on healthcare systems all over the country, and we're all in this together. We're here to help. The online training can help support the demand, and as we look at the changing, fast-changing provider needs, online training can help push those needed changes in education and training out to those providers that are not able to come in to the office. ROI and MedPower, we're partnering to offer immediate access to these valuable online training resources. And as Matt and Brian mentioned, considering the huge financial impact of this crisis, we're offering complimentary training services for 30 days. As you review this material and see the demonstration of MedPower's tremendous capabilities, if you'd like to have a more detailed demonstration or have a deeper discussion around what we can provide to you today in the long-term application of these tools, feel free to reach out to myself at jeff.tennant@roihs.com, and we look forward to hearing from you. We hope this has been helpful for you, and we realize that we're all in this together.